morning. For our first discussion, let me introduce Dr. Chethan Sathya, who is a pediatric trauma surgeon at Northwell Health. He's the director of the Center for Gun Violence Prevention there. He's a noted expert on the issue, as well as an NIH-funded firearm injury prevention researcher. And so, welcome, first of all.
Thank you.
Nice to talk to you, and thank you for coming today.
Thank you, Lena.
Chethan, I first wanted to ask you how you came to study the issue of gun violence as a physician.
My eyes were open to this epidemic as a pediatric surgeon in Chicago. And I often tell this story. My first week on the job, I had to treat a 6-month-old baby with a bullet wound. And many of you have nieces, nephews, kids. You can only imagine what that experience was like. That child, I had both fingers on the bullet wounds, blood gushing out, and that baby's eyes were rolling to the back of her head. And I still remember her earrings looking very similar to my own daughter's baby earrings. And, you know, in pediatric trauma, the family comes into the trauma bay with you. So you can imagine you're trying to save this baby's life, but the parents are right there as well. So you can only imagine the hysterical reaction. We actually saved that baby's life, but I keep in touch with that family because that child is still paralyzed to this date, really speaking to the devastating injuries that are caused by bullets. And it hasn't stopped since that day. I saw kids like that every week. In New York, where I am right now, we had a 350% increase in the number of kids with gun injuries just last year. 350%. And we see kids who have suicide attempts, accidental injuries, mass shootings, and violence. We see it all. And I can tell you it happens to every single community out there. When we talk about a public health approach to gun violence, everyone has to remember that very little research has been done in the field. There was a federal ban on gun violence research up until 2019. And as a result, it's very much like a new disease. There's a lot of innovation that needs to happen. There's a lot of study that needs to happen. So there's a lot of work that we have to do to understand what a successful public health approach means to this.
What about when a clinician is seeing a patient? How might they approach the conversation? And what are some strategies that you have found to be useful in your own clinical practice and also as adopted by your institution?
Yeah. We at Northwell have a universal screening approach. We've screened 40,000 patients now, and we basically ask any patient who comes into our hospital questions about gun violence risk. Our screening is comprehensive. So if you come into a Northwell hospital, you get a question around access to a firearm within or outside of the household, but you also get questions around firearm violence risk. There's a validated score. For example, how many times in the last 6 months have you had a gun pulled on you? We know that these types of questions are highly predictive of your chance of getting shot in the next 6 months. So we comprehensively screen. If you screen positive for firearm access, we give safety counseling, gun locks, and community resources with our gun owners in the community. And if you screen positive for firearm violence, you get what we call community violence intervention. So working with community organizations to help stop the cycle of violence, offer mentorship opportunities, employment opportunities, food security, and the other social determinants of health that are very much linked to firearm violence.
What types of policy interventions do you think are the most promising?
We need to kind of broaden our scope of what policies do what. Because the main driver of gun injuries in this country, the big numbers you're seeing, is all firearm violence. Firearm suicide is still accounting for 6 in 10 gun deaths in this country, but that number has stayed the same for the last 10 years. It's firearm violence that has really escalated, and so we need to take a more nuanced look. We also unintentionally polarize the topic. That's what I was mentioning earlier, right? So by not being nuanced, you almost vilify gun owners for something they might not feel responsible for, and you vilify Black and brown minority communities for a type of firearm death that they're not responsible for. And so I think it's up to us to really reevaluate how we are messengers for that.
Thank you very much. Please join me in thanking our first panelist of the day, Dr. Chethan Sathya. Thank you.